Hey,
Hello.
Gregory, how are you?
I'm good, thank you. How are you doing?
Doing great. Thanks so much for joining me.
Thanks for having me.
So, for those who don't know you, you have a really cool YouTube channel, and I think the focus is Disney. That's the big one. My family is crazy about Disney as well. So, my
Uh,
in-laws typically, they've been vacationing there like pretty much every year before this whole COVID fiasco. They share the enthusiasm along with you. And I know you recently, relatively recently, started chronicling kind of your hair transplant journey and experience.
yes, yeah, yeah. It's and the views have been quite good on that. I wasn't expecting it to, because it's so different from everything I've done before. Because I talk about Disney a lot, and then to go from that to talking about hair transplants is a very is a big change for like my following, but it's
Yeah, yeah.
yeah, it's done really well.
No, I think it's really interesting. Yeah, exactly that kind of dichotomy. So when my team sort of found your stuff online, they were like, "Wow, that'd be really cool for you to talk to him and just kind of see what it was like for him." And my approach and my practice, as you know, I mean, I do hair transplants, but I also have an autoimmune hair loss condition. So I'm just all about kind of educating people, telling them, all about the different types of hair loss, but also the nitty gritty about hair transplant because there's a lot of misconceptions and sort of myths and other, the good, the bad, and the ugly in our field. And so I think it's great when you have someone who's had a procedure sort of talking about it and educating others. I thought it'd be kind of cool to get together, talk about what you went through, sort of like your whole journey more or less summarized. And here and there I'm happy to sort of contribute some thoughts, but it's more about just kind of letting you have the podium.
I'm more than happy to share my own experience, but
Oh, that's awesome. I really appreciate that. So I guess, like, when was your procedure and how are you doing now?
so the procedure was 13th of July, I think it was, so early July,
Hmm.
um, and it was all it was good. It was great. So we've obviously we'd been in COVID lockdown, so everything's closed and everything. But I'd had my consultation with this place before COVID was even a thing, and
Right.
they gave me this quote, and I would love to have jumped straight at that. It was a lot of money, and so
Yeah.
I didn't have like the money to spend on it at that point. So I just said I'll put it off for a bit, and then COVID came along,
Hmm.
and I think with everything being shut down, and there's a lot of like places that were trying to like recoup their losses by like offering deals and loads of different things. So the place that I went to, they sent this offer out where I'd save a certain percentage if I booked by a certain time. And so I jumped at the chance. I was like, well, I was already willing to go to you, but I just didn't have the funds at that point. But now it's much more manageable. That was why I decided to then just like take the plunge and do it. And
Yeah.
also working from home, it was the perfect time to do it because I
Yeah.
wasn't going to be leaving the house or going anywhere. So
Yeah.
any sort of like recovery process, I'm going to be able to do it from the comfort of home.
So this is July of 2020.
Yes.
Right.
So
Okay.
it's been 4 months so far. So I'm still in the like the early stages of it really. It's going really well. I remember I did a update on my third month,
Right.
and that was when the hair had literally just started to like grow through. It was like baby hairs, and I was so excited about it. But looking back at those pictures that I took at 3 months to how it is right now is completely different because there's so much more hair. So I'm even more excited about it now.
Yeah, for sure. I think there's a scary period in the first few months when people feel like did it not work? Like, was it a
Yeah,
total, effort and money and all those things? So that there's a lot of hand holding from my end for, to get patients
yeah.
at that early period. And then when they start seeing some results, they're like, oh, okay, like things start to kind of relax a little bit. I guess taking a step back, what made you want to get the transplant in the first place? Like, how long were you thinking about it? Like, or did you consider other options?
To be honest, it's been like since I was about 15, so that's like half of my life. I've just always wanted to get it done. I remember being 15 and I was a big fan of Buffy the Vampire Slayer, and there's the actor David Boreanaz's Angel, and
Okay.
I wanted to have my hair like his all the time, and he had it like short and spiky and like all up at the front.
Yeah.
But because my natural hairline is in that like it's in the M sort of shape. It's always been in that kind of like receding hairline shape without it actually being receding. So I always just wanted to bring down the sides basically
Hmm.
of it for the longest time. And it's just, yeah, it's something I've always wanted to do. I just wanted to have a nice straight hairline.
So pretty much for you, there weren't really any other great options like for the hair restoration. Because sometimes, people come in and they ask about PRP and those types of things, but I tell them when you don't have hair at all in a location, it's these other things aren't going to help you Rogaine, all those types of other alternatives for hair restoration. So you kind of really wanted to put hair where there was no hair.
Yeah.
Gotcha. Gotcha. And so how did you go about choosing? I know you mentioned the clinic that you found that you liked when, even though initially maybe their price was too high or whatever, but what was that like? Like, how did you pick them? How did you find them?
Before I picked them, I'd shopped around. I'd gone to a lot of different ones. Over the years, I've looked at different places and got different quotes when I've been at different stages in my life where I've probably just not been in a good position to pay for it. But then I found this Vinci Hair Clinic. It was around the corner from where I work in London. I work in healthcare anyway. That's when I'm not doing the social media stuff. I work in healthcare. And this place is around the corner. So I just popped in after work for my consultation, loved the facility. They were really, really nice. The consultant was nice. It told me like everything that I would like expect to get. They told me who my surgeon would be. And he's on Instagram, so I follow him on Instagram. I've seen all these before and after pictures for the stuff that he's specifically done.
Yeah.
And it's all been really good. Checked him up on the, so he's GMC registered, which is good. Obviously, you want to...
I'm not familiar with that here in the States.
The General Medical Council? Is it the General Medical Council? Yeah.
Okay. Kind of the board, I guess. And I guess it would be like board certified, so they're be by you guys. Yeah, okay.
Yeah. So it's legit, which is an important thing when you're picking a doctor to slice you open in any way.
Yes, for sure. Yeah, because I think not everyone realizes that it's such a team effort. Like, do you remember how many people were working on you? Like, were in the room helping the doctor?
There was 3 nurses that were probably nurses. There must have been nurses that were actually like taking out so he did all the injections. And then they got the nurses to take out all of the hair follicles from the back of my head. Yeah. Then he did all the incisions, and then they put all of the things back, the hair follicles into the holes. So he didn't take anything out or put anything in, but he did all of the injections, the incisions, and everything like that.
That's good. See, there's a lot of controversy. Well, first of all, not everyone understands that like it's a big team effort. It always is, no matter where you go. So some people come to me and they want me to do the whole thing. I tell them that's not practical because it's just like all day. It's just too much work for any one person, unless it's a really, really small procedure. You just need like 10 grafts somewhere to just touch up an eyebrow or something like that. I always tell people it's a big team effort, but there's some controversy like on our end, like, from a provider standpoint of like, who's doing what and how much can you relegate or delegate to, an assistant, like a technician or a nurse to do. And because there's some people where, they'll find a patient as a clinic or a doctor and they just bring in the technicians and then they really don't participate in the transplant at all. So, and then you have the other extreme where someone's really involved in every little step of it. So there's kind of a spectrum there. But I think at a minimum, making all the recipient sites is like the most critical part. So exactly what your surgeon did, I think, is the most critical because that's going to guide, the direction of growth, the density, all those things. Not everyone realizes like that there are so many different steps to this procedure. And so what was like the experience like for you, like day of? Like, was it painful? Was it...
The only pain that I actually felt was the initial injections of the anesthetic. So it was that maybe the first, like, because they do it in rows, don't they? He did it in a line, and then another line above that, and then another line above that, or something. But it was just the first row that I could feel it. But as soon as that had kicked in, I couldn't feel a thing. Like, you could like sense that something was happening at the back of your head, like a little tapping. There was no actual like pain. It was maybe a little bit uncomfortable, like because I was lying face down for
hours,
3-4 hours or something as they were taking it all out. So that was uncomfortable, but not painful.
Okay. And then what about in the front? They also numb the front for you?
Yes. So the first one that went in there, that was painful. But as soon as that had kicked in, it was fine.
That's good. How did you pass the time during the surgery? Because it does, take most of the day. It feels like it's the whole day.
Like if you go for a massage and you're lying on a massage bed and you've got the hole cut out so your face can go through it. So that was basically my face like this, and I had my phone underneath, so I was just on my phone the whole time when they were taking it all out the back. And then when they were doing the front, they had a TV on so I could watch Netflix, and then I filmed odd bits of it as well with my camera. So I've got that all on my YouTube channel. So.
Country, basically. So,
Yeah.
that. Yeah, in my clinic with the morning part, we'll give some Ambien and Valium so patients can actually like kind of doze off and sleep a little bit more. But I have some patients who refuse to take that stuff and they just want to, like you be on the phone and be more like present, and that's fine. Did you have like a lunch break?
Yeah, we had a lunch break. Now that you've said Valium, you've reminded me that they did give me Valium so that I could relax.
Yeah, okay.
But I still wanted to, because I am like filming the whole like process, I wanted to like get bits of it, so that's why I managed to like use my phone to get bits of it and things like that. Yeah, we had a lunch break, so did the like 4 hours in the morning, whatever it was, had like a hour lunch break, and then came back and straight to it with the front.
Right. Is there anything that you think could have been better about your experience? Because I don't often ask my patients that question, but it's something that I probably should ask them more often. Because, you know, we all do things a certain way, and we're just like, this is the way we do it. But then the way it's perceived on the patient's end can, you know, it's different.
If you're getting like a surgery done that's like a long surgery like that, you kind of just expect it to be kind of like, it's not an exciting situation. You're not going to be having the most amazing time of your life as you're lying there still for 8 hours of a day.
Right.
And maybe the lunch could have been better or something. It could have been a better sandwich. I don't know. But it wasn't. I wouldn't change anything.
Got it. Now, in terms of how they removed the hairs, did they give you options for doing it with a shave versus like not shaving your hair, or was there any option like that, or what did they do for the back?
I said to them I would really prefer to not shave my head, and because where I was getting it done, I mean, anyone listening to this isn't going to see it, but you guys are going to see it. There wasn't hair there anyway, and they were just putting it onto area where there was no hair.
Right.
They just didn't need to shave my head. They could just pull on my hair back and tie it up, and then do it that way.
What about
they shaved the back, obviously.
They shaved the back, yeah.
Shaved the back really, really short, and then they shaved the sides as well really short. So I had a hideous haircut for a while.
Yeah.
It looked awful.
It's interesting. There are different ways, of course, to remove the hairs. I don't know, did they talk to you about like a strip procedure where you cut out a whole section from the back? And then,
like FUT?
Yeah.
I think that was at the consultation stage. They were saying like, well, what type would you prefer to go for? And I said absolutely an FUE, not an FUT. I do tend to have my hair quite short at the back, and that can leave quite a visible scar at the back, can't it? That if you have the FUT, because it's taken the strip, whereas this is a much less noticeable like scarring situation, because it's just like light patchy scars, but you can't even see, now that my hair's like grown over, you can't even see that I've had it done at the back.
Right. Healing is very fast for the FUE for sure. With the FUT, I would say there are two main advantages, and I rarely do it in my practice, but just to kind of point out to people. One advantage is that you can keep your hair nice and long on the back, you know, so that when you're done with the procedure, no one knows you had anything done, because, you know, there's nothing to really shave. But of course, in the future, if you wear your hair short, then you have this like line, and it doesn't always heal great, so you can have a really thick line, and, you know, people have some scarring issues with that sometimes. The other advantage is that you can get more grafts over like the course of a lifetime compared to FUE, just because of the nature of how you're removing it. You know, it's not like necessarily an inferior method, you know, in all regards. Like, so there's some advantages. And then in terms of FUE, sometimes like you don't have to necessarily shave the whole back. So there are ways of doing it, no shave technique. And then I was just at our like international conference virtually. We had virtual sort of hair restoration conference, and there's an increasing kind of trend in people doing what's called long hair preview FUE, which is really challenging, actually, just technically very hard. So it's taking it out one by one, but keeping the hair long. So when you're done with the transplant, you actually see the final result of what it'll look like in a year, because the hair will fall out still back, but when you're like the same day, you see the hair long, which is really interesting. There are some people around the country, not too many people in the States, because it just takes so long. You need to have, like, I don't know, lots of technicians. I mean, you need to have a lot of help. But there are some people moving towards that just because, you know, people, it's like an emotional experience when you're done, because you can see it, like, almost like in its final form. But you don't know if the person's going to end up looking like that in a year, you know, because they might lose of the hairs. Obviously, they'll fall out in a few weeks, but, you know, that doesn't mean they'll all grow back. You know, it's getting like, there are lots of options these days for how to remove FUE. Anything that's surprised you about the recovery process?
Well, they told me to expect some swelling. The level of how much my face swelled up was a bit shocking. I wasn't expecting my face to balloon quite as much as it did. I know some places they have a band, and they put a band around your head, I think, to keep the swelling at the top, but I didn't do that. I found that out afterwards. Like, all of I get my forehead swelled up really, really big, and then that just gradually like moved down my face throughout the days. I think it only lasted about 4 days, and I was back to normal. But yeah, I'd say just how much my face enlarged was the most shocking thing.
Wow.
Just after the shedding phase, when you're into the dormant phase, when you like nothing happens, that was I don't know if I'd say shocking, but it was probably the most stressful for me, because that's obviously the part where everyone that's had it done panics that it's not going to grow back. So I've lost all of the hairs, and I'm looking, and I'm like, there's nothing there. I think everything was I was expecting everything to happen that did happen. So
right. Did they have for you sort of a post-operative care, and when you could wash your hair and all those things written out, so you kind of knew?
Yeah, I had a whole pack of like the timeline to expect as well, and the instructions on when I could wash my hair, how to wash my hair, because it's still like we weren't supposed to be going. They're trying to limit people going out and everything because of COVID. So normally I would have gone back into their clinic, and they would have washed my hair for me and then showed me how to do it. Because of COVID, I had to do it at home. Yeah, and so that was part of the care package, the aftercare package, and they gave me a spray as well, so I could spritz it all the time to keep it kind of moist and not dried out and things. And to also help remove any of the crusts and stuff. That's
good. Yeah, the swelling happens, you know, to everybody, especially if you have a hairline lowering procedure, which essentially is kind of what you had. It definitely always swells, and I tell people because of gravity, you know, it's going to descend down your face essentially. So that's the main reason for like telling people to take off for 3 to 4 days, because some people want to go back to work the next day. I tell them, you know, you're going to be kind of swollen up. I do put a little bit of like a steroid in the mix for the injection up front. And that's supposed to limit, you know, the swelling, but, you know, no matter what you do, you're still going to get just, it's kind of traumatic for that area of the face. So overall, I mean, it sounds like you're happy that you went through the process, even though you haven't seen like the final results.
It's all gone really good. I'm definitely happy with it so far. I'm not really sure what else to say other than I'm really, really happy with it. I've wanted it for so long. I finally got it, and it's growing through as I was expecting it to. I'm ecstatically happy. I mean, look at it. It's good. It's growing.
It's what you wanted. So it's nice when you see it finally, you know, materialized, right?
Yeah. Yeah.
And then do you have any advice for other people who might be considering a transplant, don't know kind of how to start the process, or I don't know, anything you want to share with people?
I'd say absolutely go for it. If it's something you've been wanting to do for a really long time, or even if it's something you just really want to do, just do it. But as long as you're doing it for you, then that's the main thing. I've wanted this done since I was 15. It's for me. It's not for anyone else. And it's something that people didn't even know that it was something that I wanted to have done, because my hair is always quite long, and I've always kept it down on my face just to hide it. Or if I've like style my hair up, then I have to do it really carefully, so it kind of like swoops down and then goes up. So it's spending hours a day on just styling my hair in a way that people can't see what I'm insecure about. So now I don't have to be insecure about it because I've had this done. So just if you're going to get it done, do it for you. Don't do it for anyone else. And make sure you shop around, find the right person to do it. And yeah, don't expect instant results. It's not going to happen instantly.
So you're at month 4. I mean, I tell people to really give it the full year, you know, before judging the final result.
Yeah.
Is that what they told you in your clinic?
Yeah, they said 6 months is when you'll probably start to see something growing, and then a year is when you're going to have something that's much more substantial to understand like what it looks like. But 18 months is when you're going to get the real full results. So a year and a half, and then that's so it's a long time. It's a long process, but it will be worth it in the end.
Yeah, that's awesome. I think our video is getting a little choppy. Who knows, some reception, I guess, issues. But we've probably covered most of the grounds. Anything else you wanted to add, Gregory?
I think that's pretty much everything.
Yeah, we covered all that. So, question of, is the hair that was cut returned to normal length / you could hide the front? I'm assuming they mean like that right now the hair is still short. Like, will it grow to a full length? And the answer is yes. I mean, it'll continue to grow, just like it would on the back. It continues to grow long. It just takes time for it to reach a certain length. This was great, and I applaud you for talking about, you know, this whole journey with and being so open about it, because a lot of my patients, especially, you know, I mean, I do a lot of female hair transplants too, but a lot of my male patients, they don't really want anyone to know. You know, they just kind of feel like it's very personal, and they're afraid that others will find out that they had anything done. I think we're entering an era when people are a little bit more open about, you know, getting some sort of surgery to enhance their appearance. I hope that people start to feel like more normal talking about it, because, you know, like the celebrities are getting it, and they say, oh, I didn't have anything done, you know, it's all natural, and then people feel like shit because it's like, well, how come I can't look like that? And there's, you know, with different tweaks and things like that, how you can achieve sort of closer to what, you know, like you said, as long as you're doing it for yourself, you know, those kind of goals.
Yeah, completely. I completely agree.
Well,
Someone asked what I had for lunch. I had a sandwich and crisps, or chips, potato chips.
Nice. I'll be watching more of your videos, definitely. And whether it's on hair transplant or the Disney stuff, and my in-laws are now hooked on your channel as well. Looking forward to more of your material, and thanks so much for joining me here today.
Well, thank you for having me. I will enjoy watching more of your, like, the lip, the lip lift you do. Amazing. Yeah. I want that done.
I do a lot of these lip surgeries. I actually just came out with the video today. It was like one of these reaction videos. I don't know if you've gotten into that yet, but like watching someone else's video on YouTube and reacting to it. And my team thought it'd be fun, so I did one actually reacting to another plastic surgeon who says that lip lifts are bad for young people. And so my message was, well, I do a lot of them on young people, and they are very happy for the most part, so I don't think that it's a bad thing across the board. Of course, there's always risks and all that, so I put out a video like that. But right now, my practice is a lot of hair and lip stuff, but I also do, you know, a full range of kind of facial plastics, so it's fun. I work just like you kind of have like your sort of, I guess, a regular job, or like whichever one's the side job, I don't know, in terms of what I do, other than like whatever YouTube. It's just kind of part of my practice, I guess. But, you know, I work with veterans at the Brooklyn and the Manhattan VA, and I do their reconstructive surgeries, so that's kind of like my other hat. And so it's fun to balance like the aesthetic practice and kind of the cosmetic side. Yeah. The whole other end. But I tell people that I don't think there's like a distinct like difference between cosmetic and function. You know, I think when you're dealing with the face, any procedure on the face, and obviously the scalp and hair, it's all intertwined. You know, maybe with hair there's not as much of maybe a functional component to it, but still it all works together, you know. And whether you had like, you know, a blast in Iraq and you lost, you know, your hair from that, or you just don't have the shape of, you know, of your hairline that you wish. I mean, the approaches are all the same. So keep in touch, and yeah, look forward to the next you know, hair update for sure. You know, I hope you get, you know, it looks like already you're getting a nice result, and I'm sure it's growing very well.
Thanks. I'm glad you think so.
Yeah.
All right.
Awesome.
Cool. Well, it's great to chat to you, and yeah, speak soon.
Likewise. Thanks, Gregory. See you. Take care.
Bye.
Bye.